Speaking at the Developing Evidence and Action Towards a Double Duty Food-Based Policy Bundle to Assure Healthier Diet in Ghana was the Minister of Health, Honorable Kwaku Manu, in a statement said that government is ready to support in the promotion of healthier diet for healthy lives in working together with the stakeholders across the globe in the implementation of the policy of healthy food environment.
Equity, good health, and better nutrition. We will strongly make healthy food environments a priority. Distinguished ladies and gentlemen, ensuring healthy lives and promoting well-being for all at all ages is not meaningful if healthy food environments is not a priority. I think we will work with key stakeholders across the globe in implementing the 4 work packages and maintain international momentum. We are grateful for the support countries get for development partners, especially the Rockefeller Foundation and the International Global Research Center, IDRC Canada, funders of the HD4HL project. It is my sincere hope that together we will all continue to support and sustain the development and implementation of the double duty policy bundles to improve diets. Let us make this project as strong as possible, develop practical way forward, see to the implementation of the policies, develop practical way forward, see to the implementation of the policies and make all the necessary noise for healthy food environments. Be assured that Ghana will not remain behind. We are determined to be the leader and best practice country for healthy food environments. At this stage, let me again take the very singular honor to declare the Healthier Diets for Healthy Lives project duly launched.
Also speaking at the event was the Member of the Parliament, Honorable Sebastian Sadare. In a statement said that they are ready to play a significant role in the organization of the objective initiatives to carry out advocacy range towards the healthier food environment in Ghana.
We pledge to play a significant role in the realization of the objectives of this initiative, especially through mobilizing CSOs to carry out evidence-based advocacy work towards a healthier food environment in Ghana, as well as to hold food environment actors accountable for their actions.
We are all excited for today's program, which is the launch of the Healthier Diets for Healthy Life project. And we all know that health is very important for productivity, and the food that we eat determines who we are. In other words, having nutritious, well-balanced diet help us to be healthy. Then we can be strong and work and produce and develop our economy as a country. So we say health and productivity are interrelated. And you know that nutrition is a determinant of health. So ensuring that we have safe food or healthier diets is the whole objective of this launch. And therefore, I really represent civil society. That is the coalition of actors for public health advocacy. As the name suggests, just to advocate, for people to change lifestyle and ensure that we have a very safe food environment that would ensure we eat healthy food that would reduce the burden of non-communicable diseases. I'm also a lawmaker and a member of parliament, so ensuring that we have the adequate legal framework that will regulate the kind of food we eat and the food environment we see around us is very, very critical, and I'm excited to be here. It wouldn't end here. It means I have to take the issues that are being discussed here onto the House, onto the floor of the House, and even the Health Committee, of which I am a member, so that this very critical project that we are launching will translate it into very strong policy, have legal framework, and ensure that as people, as Ghanaians, we are healthy, we eat healthier diets so that we can have healthy lives as a people of this country.
Those who spoke earlier, codenamed Healthier Diet for Healthy Lives project. This project, among others, are aimed to deploy a multi-pronged intervention. There's an advocacy bit, there's evidence synthesis bit that the academics are going to lead, but there's also policy development and implementation bit that the government actors are going to. As the one we have started. The engagements have started. The evidence that the academics are going to be synthesizing, curating, and then availing to different stakeholders to make use of, that has already started. In terms of policy making, so as we refer to it, we are interested in generating a bundle of different policies. They are referred to as double duty policy bundle, in that the policies are going to focus on addressing our age-old problem of undernutrition, but also overweight, obesity, and diet-related non-communicable diseases. And so in the bundle overall, we are interested in improving the Ghanaian food environment. And by that, among others, we would be able to make a healthy diet of food unattractive and available, whilst making healthier food available, attractive, and affordable to all Ghanaians. We operate with a logic model. We refer to it as if, then, therefore logic model, which has always been the belief of academia that if governments everywhere implement policies that seek to restrict the practices that were outlined, so marketing of unhealthy food, production of same, and therefore availing of those unhealthy food to the population. If we have policies that limit, regulate, or legislate them, we believe food environment actors, which include industry and you and I, would make immediate but also strategic decisions that could impact negatively on importation, production, and use.
Country, there's a lot of ignorance, and because of that ignorance, we are just eating anything that we can grab, but that is living dangerously. So there's a point about having healthy diets. Why are we saying that we are living dangerously? You have a lot of non-communicable diseases as a result of unhealthy diets. So if we are able to sanitize our food environment, then it will make these healthy diets available for people to eat. So what the policies we try to do is to discourage, for instance, provide sufficient information on the kinds of food that we are buying, especially on the shelves in our shops, to restricting the availability of unhealthy foods, and rather improving access to healthy foods, so that we are not tempted to eat anything that comes our way because our environment has been sanitized. So let me give an example. You come to a hotel, we are talking about healthy diet, and they serve a lot of sugary drinks, Fanta, Coke, all of that. Juxtapose that to another place where you see fruits, vegetables, a lot of water, they encourage you. So you see that the environment actually shapes the kinds of things that you eat. So this is a very, very...
all that will finally land in our facilities. So we quite appreciate today's program, and definitely for healthy diets for healthy lives sits in very well with the non-communicable disease department of the Ghana Health Service. Then there's the wellness program of the Ghana Health Service, which has to also make sure that people live healthy lives, including diets. Now that intersects with what we call the healthy aging program, because you find out that as we talk, most of these diets which are unhealthy, or we take a healthy diet, that then simply gets us into healthy aging. And so you would find out that things keep accumulating right from maybe the childhood. You develop all these conditions in the end, which then leads to quite problematic issues during. It's really quite mind-boggling when you have one NCD which actually would have appeared because we failed to make sure that people led healthy lives. And so once you get this program being implemented, it gets all of us right from all the vulnerable groups, children, adolescents. I think you heard some of the key speakers actually mentioning those vulnerable groups. Sometimes we tend to think that this doesn't apply to the rural communities. It has to apply to East Legon and then Ashadabuche and all those areas. But you'll be very surprised what is happening in the rural communities these days. And so it is something in which it has to be all-inclusive and comprehensive enough to get all of us, including you and me, being very healthy in this country. So for the Ghana Health Service, well, I think you know us more for COVID than for anything else. Yes, that is a small play. COVID is small play. It comes and then it goes. But the economic burden of NCDs, these don't go away. I don't think to the end of the world they go away. So we would then have to try and reduce the burden very considerably. Otherwise, it puts a very great strain on the national economy and budget.
We always say you are what you eat. And this program is basically about how do you define what the Ghanaians eat in such a way that come 10, 20, 30 years from now, we can have Ghanaians who are healthy. And increasingly, I'm sure you are all seeing, we are getting more obesity around. You go to most of our primary schools, secondary schools, we are having a lot of, especially obesity around the abdomen, which is quite dangerous. So what we aim to do with this project is basically to look at how do we promote healthy diets. Labeling of our food products in such a way that you even know what you are buying. That if it's low sugar, it's labeled. If it's low salt, it's labeled. Getting zoning of food facilities, organic foods. So clearly it's going to help us demarcate what we can eat which are healthy. So people can go to the market knowing what they are buying. As it stands now, people really don't know what they buy. And they don't even know whether they are getting organic food, low sugar, low salt. So the aim of this project is to work with the relevant agencies, Ministry of Health, be the main ministry, the Food and Drugs Authority, the Ghana Health Service, and National Development Planning Commission to basically look at how we define food-based policy bundles that will enable the Ghanaian to be healthy and achieve that cliché. As you can see, we are working with those who even ensure the implementation is done. That's why the Food and Drugs Authority is here, because they are to ensure regulation of food products on the market. So they are going to ensure that when their inspectors go out, they are checking out for all these things we mentioned, and ensure that those who are caught are culpable. But they have the laws also behind them, as part of the Public Health Act, to identify those who are flouting the rules, which we are helping to define. So that's how the implementation is. The regulators are part and parcel. So it's starting from now. So I won't say timeline because we just even don't want the project, we want the program. So this just kick-starting what we want to see going on for a long time, actually forever.
So by
in the next 3 years, we should see a lot of implementation.